everyone, welcome to Pathomed. Today, let us discuss a case of invasive lobular carcinoma. Firstly, let's see a brief anatomy of the breast. Each breast it is made up of almost 15 to 20 lobes, which contain many lobular units. And each lobe they terminate into the lactiferous ducts. These are the lobes. They contain many lobules, and they each lobe ultimately terminate into a lactiferous duct. These are the ducts. So it is mainly composed of the glandular element, which are the lobules, and ductal elements, which are lactiferous ducts. In this image, this is the normal lobule, which is lined by simple cuboidal epithelium. In this image, these are the tumor cells, the lumen filled up with tumor cells, and these tumor cells are confined within the lumen. They do not invade into the adjacent tissues. They are confined within the lumen. It is said to be in situ. It is present inside the lumen. It is said to be in situ carcinoma, lobular in situ carcinoma. If suppose these tumor cells, when they breach through the basement membrane and they invade the adjacent tissues, when they breach and invade the adjacent tissues, it is said to be invasive lobular carcinoma. So, this is a gross image showing a mastectomy specimen of left breast. It is measuring 17 into 16 into 4 centimeters, and 21 lymph nodes were dissected from this breast. This is the axillary tail. This is left breast. So this becomes the lateral margin. This becomes the medial margin. This becomes the superior margin. This becomes the inferior margin. And this nipple area, this is the anterior surface. The underneath surface is the is the posterior surface. So this is the cut section image. Here you can see the solid gray-white tumor tissue. This is the tumor tissue on cut section. And this breast was grossed as per the slicing method, that is bread loafing method. You will have serial sections of slicing about 1 centimeter distance. 1 centimeters at 1 centimeter distance you give slices. This is called bread loafing method. Bread loafing method. This is the microscopic image. Here you can see the tumor cells arranged in single file or the Indian file pattern. That is, these tumor cells, see, tumor cell, tumor cell, tumor cell. They are almost dyscohesive, not too adherent to each other, and they are in line one after another. Normally, if tumor cells are there, they form a clump. We don't see any clumps or aggregates here. They are like dispersed one after the other in a single line. This is called typical Indian file pattern. Indian file pattern. In olden days, Indians used to go for hunting in this orderly way. So this is Indian file pattern. And also you can see dense fibrosis here around the cells. This is again another higher power view showing you the Indian file pattern. See the cells scattered and they are dyscohesive. This dyscohesiveness, it is due to a loss of E-cadherin. So the cell-to-cell adhesion molecules are lost, and hence they are dispersed or they show this dyscohesive pattern in the stroma. This is very typical of lobular carcinoma. Very typical of lobular carcinoma is the Indian file pattern. And also, you see this periductal arrangement of tumor cells. This is a normal duct. Normal duct, you can see the lumen. So these are the tumor cells. Tumor cells. They are concentrically arranged around a normal duct. It is like a targetoid fashion. It is called targetoid pattern. Targetoid pattern of arrangement of tumor cells around a normal duct, which is also typical of lobular carcinoma. Here another, in this specimen, even lobular carcinoma in situ was present. See, this is one lobule. Inside the lobule, it is filled up with tumor cells. In a normal lobule, it contains, you can see alveoli, many alveoli can be seen. Here no alveoli, it is entirely filled up with this tumor cells. This is hyper view. This is like each lobule, it's cut section. You got the half view entirely filled up with tumor cells. This is a lymph node, one of the lymph node for showing infiltration by the tumor cells. Yeah, thank you.